All right, today I'm going to talk to you about what is functional medicine and why you should get it and why you should also promote it to the people that you love and care about. So functional medicine is better than conventional medicine because it allows the ability to be preventing things that are preventable, and it allows you to be proactive about your health rather than having to be reactive about your health. And I'm going to explain this. So basically, if you look at this, this little chart right here, you know, if you take any particular lab when you go get your blood done, there is a lab reference range. And this lab reference range is variable from one lab to the next. So if I send you to the local hospital to go get blood work done, some labs have one range, but if I send you to a different hospital, then there's a different range. And if I send you to a different hospital, it's even a different range. So in other words, it's variable as far as a particular lab. So calcium, for example, can be variable from one lab to another to another. That's unfortunate because it's not even uniform. But when you think about a lab, if there's a range of any kind, don't you want your lab to be right in the middle of that range? And that's what functional medicine is. Functional medicine is getting you into that center part of the range so that you can have optimal function. This is where your cells are working in perfect homeostasis, where they have the ability to keep you alive and healthy on a cellular level. This is the most perfect situation. So the functional medicine, the goal is to get you into this perfect center range. This is where you don't have any symptoms, and this is where you're actually preventing things that are preventable, like the degenerative diseases that people get in our country, in the United States. So I'll give you an example. So if you just take cardiovascular disease, about 80% of people will die from that in America. So we're talking about heart attacks, strokes, aneurysms. If it's preventable, why aren't we preventing it? And if you look at cancer, 1 in 2 men, 1 in 3 women, and there's way more degenerative diseases than that. But these are huge. We should be extremely proactive about our health because we have certain genes. We want to make sure we're not turning on those genes so that they can become expressed in the form of a disease. So the goal is to get you right here into this perfect functional range. So the lab will flag something if it's on the high end of this reference range or if it's on the low end of this reference range. And you will have symptoms of some sort when you get to this point. Most doctors don't even they don't even care about your labs until it's already beyond the lab reference range, so high or low. But there's another area that's in between. I call this imperfect. So imperfect is where you're in between the perfect functional range or in the pathological range. So it's that in-between area. So the goal with functional medicine is if your labs are on the high end is to kind of push it more towards the center. And if it's on the low end, same thing, push it towards the center. So this is the goal, and we do it with lifestyle changes. You know, you should be thinking for the rest of your life about how can I be healthy, because it's a lifelong effort for everyone. You don't just go to the gym and work out until you have a perfect six-pack and then you never work out again. Or you don't go to the dentist and get no cavities and then now you don't have to ever brush your teeth or floss and you never have to go back again. It's a constant effort with our health. So, you know, think about what are you willing to do to have a lifestyle that promotes longevity and health and that gets you into this perfect range right here with your labs. And then talk to your spouse and talk to your children, talk to people and say, look, let's work on this together. It's hard to try to do the right thing if you live with people that are doing the wrong thing. So be on the same page and do things that are going to be proactive for your health. If you ignore your health, it will go away. And you should start thinking about your food as your medicine. And so when we're talking about functional medicine, we're talking about lifestyle and diet and supplements. Supplements basically increase the ability in a shorter period of time to push your labs towards the center here. One thing I'm going to tell you is you don't have to live in our community to be our patient and do this kind of work. So we can work from far away. We have patients in other countries. We have patients in other states. So if you know people that are interested in this, have them contact our clinic so that we can work on this stuff, and we can work on making sure people have healthier lives. And when you're healthier, you can enjoy your life better, and you can enjoy the people that you care about longer. One thing I'm also going to tell you is we have the ability to do labs very inexpensively, and sometimes it's way better to go with I have a contract with a lab. We can do it's sometimes way better to do it this way than to even use your insurance. And one thing that I like to promote for my patients is what we call a comprehensive bioscreen. This is where we look at hemoglobin A1C, we look at glucose, we do a comprehensive metabolic panel, we look at uric acid, homocysteine, a full lipid panel, the inflammatory markers, a complete thyroid panel, and we look at a urinalysis. And so it's very inexpensive to do stuff like this, and so get on top of it, start becoming proactive about your health rather than just being reactive. So I hope that helps you to think about what you want to do for your future, and I'll talk to you later.